Hello and welcome to AiArthritis Voices 360. This is the official talk show for the International Foundation for Autoimmune and Autoinflammatory Arthritis, or AiArthritis for short. My name is Leila, and I am one of your co-hosts today. I'm a person living with lupus and Sjogren's disease, and I am the health education manager here at AiArthritis. And I am joined by one of our superstar volunteers and a very passionate advocate, Bridget Serrett. And Bridget, why don't you tell the audience a little bit more about yourself, what diseases you live with, etc.
Hi, I'm Bridget Danderossaret, and I live with RA lupus, Sjogren's, Ehlers-Danlos, and a bunch of other stuff. And I have been volunteering with AI arthritis for quite some time.
Yes, Bridget is a part of a lot of our different volunteer opportunities, including the talk show, as well as very involved in the public policy and advocacy space. And so, if that's something that you're interested in, Bridget is actually part of one of our programs called AI Advocates, where we are looking for advocates who want to make a difference in the healthcare system when it has to do with AI arthritis diseases, and we're looking for people in every different state so that we can make sure that we are covering all of the different issues that are happening in the US. So definitely check out our aiarthritis.org/advocacy page to get more information about becoming an AI advocate, because that's something that's going to hopefully become a bigger program in 2026. We're super excited.
You won't regret it. So,
Yes. Alrighty. And so today we are going to be talking about oral health when it comes to AI arthritis diseases. And I think that oral health is usually something that's kind of secondary that people think about and maybe aren't thinking so much that when we're talking about these systemic diseases that oral health is something that's, important, but it actually really is and is very connected to different parts of our autoimmune or autoinflammatory arthritis diseases. And so that's why we're talking about oral health today. It's really important because some people may think that, oral health is just important because it's cosmetic and, you just want to, make sure that your teeth are there so that, you don't look a certain way. But it's more than that. It really can, even affect pain levels, fatigue, the ability to eat and hydrate properly, and again, of course, self confidence and mental health. Many patients are never really told or educated about how common dry mouth, gum inflammation, and mouth sores are in our diseases. And so we definitely want to make that known that this is not something separate from our autoimmune diseases, but a part of how systemic our all of our diseases are. And so both Bridget and I have had some experience with oral health when it comes to our autoimmune diseases, but specifically with Sjogren's disease, because one of the main symptoms of Sjogren's disease is very dry mouth. And that's actually a lot of the time how patients find out that they have Sjogren's disease is from, having such dry mouth and having issues with dental work and all of that kind of stuff. So, Bridget, why don't you kick us off and let us know a little bit about your oral health and how it's affected you and your life?
oh my. Um, so these are not optional bones. They are very integrated with everything, including our immune systems. And I was diagnosed with Sjogren's some time ago and put on Saligen, but it really didn't kick up until I had my neck fusion. And when I had my neck fusion, my mouth was so dry, I was peeling my tongue off the roof of my mouth every single morning. And unfortunately, since then, my teeth have just decayed completely. They've just crumbled from the bottoms up, from underneath the gums, which is a standard Sjogren's I'm eating your teeth kind of moment. So that has been very wild just in itself. And once you have a neck fusion, having oral surgery becomes a high risk, especially if you have a high level cervical fusion. So I was unable to get a lot of those things pulled. You're not allowed to have dental work for at least a year after the surgery, and generally sometimes more, because it can cause infections, it can cause flares, it can cause all sorts of issues. It can even infect other joints that are replaced, like my shoulder joint. Every time I have something pulled, I have to have antibiotics and I have to really watch because joints that have been replaced in my body for years, like my shoulder, could just randomly become infected. So I've learned a lot having to deal with Sjogren's. My teeth are not really real. I have no molars in the back now, and the rest of them all need to be pulled that are in there. So it's definitely been a journey.
Yeah, absolutely. And I'm in a lot of these different Sjogren's Facebook groups and things like that where I feel like half of the posts have to do sometimes with teeth and with oral health and everything that's going on. And with me, that this was actually the way that I found out that I had Sjogren's was with how dry my mouth was. And after, 2 or 3 years of shelling out 1,000, 2,000, $3,000 out of pocket for dental work, crowns and cavities and all of these different things. It's like a constant cycle that we're always on. And even thinking about it back in the day when I was a kid, I would go to the dentist and have 10 cavities and being like, what, like my mom's like, you brush your teeth every day. What's happening? Why are you having so many cavities? And this was probably when I was like 7 or 8 years old. So it was kind of like all of these things were happening from the very beginning and we had no idea like what it was caused by until I was 26 years old. And so I
Wow.
think that yeah, that was really tough and a lot of just finding out that there's so much that you have to pay for because dental insurance in this country really sucks.
Yes.
It does not cover much. Even when I had double coverage, it was like, they'll cover $1,500 total and then I'm still left with $3,000 to pay
Yes.
out of pocket. And
It's
as
so expensive.
it's so expensive. And as patients, we already have so many out of pocket costs when it comes to other parts of our autoimmune disease that this is so much of a burden that we have to deal with on a yearly basis. And I hear so many stories about patients just, avoiding going to the dentist because they know how much the bill is going to come out to be, how much they're going to have to keep going back and getting all these procedures done. And it's really frustrating. I know that we've had some legislation that is started to pass when it comes to Medicare and having some of these procedures covered by Medicare, but in the private insurance sector, there's nothing really that can help us, and it's really frustrating.
Oh, it's incredibly frustrating. And on top of that, a lot of dentists actually are not aware of what Sjogren's syndrome is. Unfortunately, years and years ago, I was on prednisone for some time, and I have not been on prednisone for many years. And they just keep going back to, oh, this is just prednisone. This is just prednisone. And it's like, no, this is textbook Sjogren's syndrome. All of my teeth are now gone or compromised. All the enamel is coming off my teeth. They're just crumbling from the bottom because I have no saliva to protect them. And it's very disheartening. So on top of the medical bills and on top of everything else, you always go into a dentist and you feel like you're being judged. You're like, "Oh, you must not brush your teeth." Oh,
Yeah.
yes, yes, I do.
No, totally. There's like definitely a shame kind of component to it because when I first was, kind of discovering with the dryness, my dentist, was like, "Yeah, what are you doing?" And I'm like, "I don't know." Like, I was thinking, maybe it has to do with my cannabis use. Thinking, "Oh, it's just cotton mouth, it's a dry mouth," but it would not cause that severe of
Yes.
decay in your teeth with that being the cause. And so I think, yeah, I have spoken to a few different dentists and friends that I've known that have become dentists, and zero education about it in any dental school. No, it's really like dentists have to do their own education on the side to even try to learn about Sjogren's disease.
Yeah. Oh, yeah. And when you go into the office, if they don't know you have Sjogren's syndrome, they are going to recommend that, oh, you just get this capped and it'll be fine, or you just get this crown and you'll be fine. And it's like, no, I'm going to be right back in here. And there's a very good chance that some of those procedures, like the crown, won't even stick.
Yeah, my crowns
So,
come off all the time.
yeah. Yeah. So I have to go in and just be like, no, we're pulling them. We're pulling them, and eventually I will get dentures. So,
Exactly. Yeah. I
yeah.
mean, it's really not worth paying for the crowns over and over again. And it's really tough. And I think the biggest thing too is just, you know, yeah, the shame part, and just, just not knowing that, the dentist not being educated on what really affects it and how systemic this disease is, and all and other autoimmune diseases as well, how much it really can affect, the whole body. And nowadays we are seeing some possible biologics that are coming out to help with systemic Sjogren's. And
Yes.
I've seen some data talking about how some of these clinical trial in the clinical trials, they're showing that the dryness is actually, improving with these very targeted biologics. And so that is super exciting for the community.
That's amazing because I was diagnosed and there really was not much you could do. Xylitol wasn't popular or well known. There was one drug that they tried, Saligen, but then I was like drooling so much. It was insane, and I had to stop that. And there was really nothing that could be done, and it's not just our mouths; it's everything from our eyes, our skin, our mouth, our teeth. I mean, just everything is dry.
Yes, exactly. So that's exciting on the horizon for the Shogun's community. And hopefully, we can in the future prevent future Shogun's patients from needing to get dentures and implants, and, protecting their teeth, starting from the beginning with a biologic. So that can be
Yes.
our hope, in the next 5 years or so. If that can be, the normal, that would be amazing for us to be able to see that come on the horizon. And so I'm going to move into talking a little bit about how oral health and our autoimmune diseases, or AI arthritis diseases, are connected. We talked a little bit about it in the previous section, but something to note is that the mouth is one of the most active immune environments that our body has. There's hundreds of bacteria that go in and out of our mouth. There's constant immune surveillance that's happening. Our body's like, well, what do we do with this bacteria? Do we need to fight this bacteria? And so keeping your mouth as clean as possible, and still doing the dental hygiene things can be very important for any autoimmune disease, because of how much bacteria and all of those things can kind of live in the mouth. So
It's the
that's
first
one.
line of defense.
Exactly, right?
Mhm. Yes, everything you put into your mouth is going to have some sort of bacteria, it's gonna have other things in it, and your mouth is kind of that first line of, "Okay, let's kill these bacterias, let's let these good one live," that sort of thing, and so your mouth is very alive, very alive.
Yeah, and with that, I mean, with when you don't have saliva in your mouth, that's, a level of protection that you don't have as well. Like the saliva is really important when it comes to the microbiome of your mouth, and everything that kind of happens there. And so, when the microbiome is disrupted or is messed up, inflammation can increase. Inflammation drives everything in
Yes.
autoimmune diseases. And inflammation in the gums is super, super common when it comes to autoimmune diseases as well. And when bacteria comes into the bloodstream through the mouth, that can really trigger flares and other autoimmune issues as well.
Absolutely, absolutely. You know, the autoimmune diseases are very sensitive, and so the minute something happens in your mouth, the entire immune system is going to go, and try to correct it, even if it doesn't need correcting. So, oral health is incredibly important.
Yeah, and it's really important to just, realize that, you can be brushing and flossing and, using the water pick and scraping your tongue and doing all of the hygiene things that you can to, help protect yourself and still have these oral health problems. So just,
Yes.
reminding yourself that this is not a user error. This is not, a failure in your hygiene
Yes.
when things like this happen. It really is just a part of the systemic nature of these autoimmune diseases. And so to not be ashamed or anything of what may be happening when it comes to oral health problems.
Absolutely, absolutely. This is not something we purposely did or a result of neglect. This is just a common and normal part of many autoimmune diseases.
Definitely. And with you, Bridget, when you started having the oral symptoms, was that like before or after that you knew it was connected to your autoimmune disease? Like did the oral issue start happening and then you're like, oh, I think this is connected to the autoimmune disease? Or were you aware when you were diagnosed with your autoimmune disease that there could be some oral health consequences?
I actually have been diagnosed with Sjogren's for over 20 years. And thankfully, I didn't really have too many issues up until recently, and maybe about 10 years ago, um, when I started with the fusion. So I knew just simply because I was peeling my tongue off my mouth. I mean, there was just no moisture in my mouth whatsoever. I knew what was going on. And unfortunately, I think a lot of people don't. They don't understand that even if you're not peeling your tongue off your mouth, even just a slightly dry mouth or having saliva production that is not quality saliva can really contribute to a lot of these problems. And you don't know they're happening until after they've happened because a lot of it is below the gum line.
Yeah, and I think a lot of the signs that you can see, especially with dry mouth, is a lot of Sjogren's patients say that they can't leave without a water bottle right next to them. You
Mhm.
talk for 5 minutes and your mouth already gets dry. All of the, chapped lips having, just dryness all around the mouth still,
Yes.
and things like that. And so yeah, I did not know before that these symptoms were connected. I didn't even know that I was at risk for Sjogren's disease having lupus, which is crazy. I was living with lupus for, 14 years before I even heard of what Sjogren's disease was. And once I found out, oh, it's a very common comorbidity to both RA and lupus. Oh, no wonder this is what I've probably been living with for just as long as I've been living with the lupus. And now it's just starting to affect me a lot more. And
Hmm.
so, yeah, it's been a journey when it comes to oral health, and I do still have um fear when it comes to going to the dentist and the sticker shock of how much you have to pay when you leave the office and the payment plans and all of these kinds of things. And so definitely just being aware is half of the battle. But there are other um types of oral health issues besides dryness, like we were talking about, that can be affected with the other AI arthritis diseases. Specifically with rheumatoid arthritis and psoriatic arthritis, there's some higher rates of gum disease and gum inflammation that is, obviously in a relationship with systemic inflammation, and a lot of even hand pain can make brushing and flossing very difficult, and the deformations in that happen in the hands can make making oral hygiene a tough task
Yes.
for patients.
I have a hard time holding a toothbrush. I have hands that don't quite grip as well as they should. Um, my deformation is not as bad as some, but I've also had surgeries. And the soft tissue has just kind of been eaten away by inflammation. So it is very difficult to hold the toothbrush and to get it where it needs to go. A lot of different things, plus the medications. The medications can actually increase and exacerbate Sjogren's and the dryness. And so, like methotrexate or prednisone or
Yes.
biologics, you find that you end up just being very, very dry.
Yes, definitely. That's what they thought it could have been originally, was any side effects from medications that was happening, causing the dryness as well. So yeah, definitely can, if you don't have specifically Sjogren's disease, then there can still be risk of dry mouth through medications. Other oral health concerns that other AI arthritis diseases have, one, with lupus, and I know that this can happen in other AI arthritis diseases as well, is mouth ulcers. Lots of mouth ulcers that can happen, and especially during flares, is one of the common symptoms that happens, and that can affect how well you're eating, if you're able to hydrate. It can cause infections and delayed healing. And even with the steroids, like with prednisone and things like that as well, it also delays healing when it comes to anything in your mouth as well. And so it's kind of just like this cycle of, you're
Yes.
taking medication because you need to bring down your inflammation, but then the medication is causing this. And it's a really hard balance to kind of to walk that tightrope of, what's happening here.
Yeah, it's like a hamster wheel, being on the autoimmune hamster wheel there.
Yes, and just one other AI arthritis disease that I wanted to highlight, some oral health concerns, is with scleroderma or systemic sclerosis. And it's a very different type of oral health that can happen, issues that can happen with scleroderma, but mostly it has to do with the tightening in the skin when it comes to scleroderma, and like this, especially around the mouth opening, it can make it very hard to eat, very hard to brush properly, floss, do any type of dental examination, because the tightening of the skin is so prominent when it comes to scleroderma. And so this can lead to higher dental trauma risk, and really the need for some adaptive tools for these patients to be able to even have standard dental hygiene. And so, really important to acknowledge that oral health is, there's so many different things that can contribute to it, and can make it difficult when it comes to autoimmune diseases.
Absolutely, absolutely.
And lastly, I wanted to go into what are some things that have helped us personally. We've talked a little bit about xylitol, and some of the other kinds of you know, interventions that we've recommended, always making sure that we're hydrated.
Yes.
That's super important. But yeah, any things that have been, helped you in particular when it comes to oral hygiene, dryness, or anything like that?
Oh, yeah, a couple things. I have an electric toothbrush, and that helps me a lot because it takes away some of the motion that I can't do with my hands anymore. But xylitol, either sucking on a lozenge or chewing some gum, and oil pulling seem to really help. I did some oil pulling. I added food grade peppermint, essential oil to it, just to kind of give your mouth that clean feeling. But that seemed to really help out for a while.
Yes, I also have had a good experience with oil pulling. It became like this fad on TikTok, very like in 2021, oil pulling was like very huge, but I didn't realize how much it was really actually helping me for my Sjogren's at that time. And I actually just I don't know if it's because we're talking about this or what happened, but I actually asked my mom for a Sonicare toothbrush for Christmas. So that's what I got for my Christmas gift because
Nice.
when I moved, I threw out my old one. So I was like, okay, I need to get back into it. Get my Sonicare toothbrush. I just ordered the Guru Nanda oil pulling kind of formula. So I'm trying to get back on it and making sure that I am taking care of my oral health because I actually they had me put a lot of things on pause with my oral with my dentist and procedures with me being pregnant. So
Yes.
that yeah, a lot of it has kind of been on pause right now. And once the baby comes, I have a crown to fix, I have cavities to get done, all of this kind of stuff. So I'm like, okay, I need to get back on the oral health game because um, it's overwhelming. There's so many things that you have to think about when it comes to these
Yes.
diseases. So yeah, definitely, I would say oil pulling is a big one. For me, the xylitol that I prefer is the mouth spray. So I have a bunch of those in my backpack, in my purse, in right next to my bed,
Yes.
all of those types of things. Just to make sure that I always have it with me. So definitely xylitol is very, very important. Like you said, electric toothbrushes. Also, one of the biggest things is being aware of how coffee or acid reflux or medications
Yes.
can affect your oral health as well, or like your dryness, or how much it's breaking down your teeth. That like
Yes.
yes,
Losing coffee, that was tragic.
yeah. That's a tough one. I'm like, is there
Yeah.
some kind of a, protective layer that I can put on my teeth so I can drink coffee or something
Yeah.
like that?
Yeah. Yeah, but sugary things, the coffee, all of those different things, it's just going to increase any type of degradation in your teeth. So you have to be really, really careful. Really
Yes.
careful.
Absolutely. And I think, kind of, just reframing that, like, not necessarily brushing and cleaning harder is the important thing here, but it's like
Yeah.
protecting and rebuilding your enamel as much as possible, keeping the enamel intact as long as you can. To prevent, the tooth loss. Unfortunately, it is very common for Sjogren's patients, even, by the age of 50 to have all of their, teeth gone and needing dentures.
Yes.
I've even heard somebody, by 35 that it's happened to them. And it's, insane to hear all of those different stories. But yes, making sure to, use toothpastes that are remineralizing, that helps with enamel repair, things like that, not necessarily, looking to aggressively clean your teeth,
Yeah.
but
Or
to
even
restore.
the whitening
Yes, it will
toothpaste.
break it down.
Yeah, maybe you don't want your teeth as bleached as you think you do, you
Yeah.
know? Especially if you wanna keep your teeth. Unfortunately, we have such a risk for weak enamel and for any little thing to get in there that's gonna break it down, and we know how bleach works. It's not a gentle substance. So you have to be really careful, and you can't even brush your teeth too hard, you know, because that can also start to wear your enamel down. So you have to be gentle and just understand this is part of having autoimmune disease. And it's not anything that you're doing wrong, but these are the things you just have to do differently.
Absolutely. And, keeping the routine and just, making sure that you do make the oral health priority for all the reasons that we've stated before. It can lead to infection and causing, worse symptoms and worse outcomes for the rest of your body. The mouth is not separate, it is a part of your body. It doesn't make sense why there's separate insurance for it. Same thing with the eyes and with the mouth. I never understood that.
Yeah, I don't get that either. These are optional body parts, apparently.
Yeah. Oh, yeah, right. Well, one other thing that I wanted to mention that has, started to have some information about it, and some patients have said that it's helpful, is actually acupuncture as well for dry mouth, even dry eyes and things like that. But when I was actually talking to Bridget about this in the, before we started recording, she actually let me know that there's some risk that she's heard about.
Yeah, absolutely. With RA, I got to the point where I was willing to try anything to try to help cut the inflammation so I could be more functional. And I started asking around about acupuncture, and about half of the people responded saying that that threw them into a major, major flare. Like the big full body, your immune system is just panicked flare. But then there were also people who really enjoyed it and it worked for them. And so that's something that you need to definitely research. I'd love to see if it actually does help the dryness. It really would.
Yeah, absolutely. And so, um, yeah, these are some of the tips that we have and some of our personal stories that come with oral care. We were trying to have one other guest on this episode, but she wasn't able to make it to our filming today. But the arthritis dietitian, or Christina Montoya, she also lived with RA and Sjogren's disease, and she has a lot of information and resources when it comes to oral health with these diseases as well. One of the resources that I referenced when, putting together some of the education for this episode, was a sheet that she gave me that were the highlights from her visit with her own dentist, who actually is a Sjogren's disease expert, which I have never heard of before.
Oh, that's a unicorn.
Yes, very much so. And she actually lives in Canada. And so, maybe they have a little bit more education about that in their dental system. But she did give us the kind of a printout of some more information for some other tips. There's, something that's called silver diamine fluoride that helps to harden the tooth structure and prevent common gum line cavities, as and the rest of the things that we actually kind of mentioned are there as well. So yeah, definitely checking out Christina Montoya's page that's on Instagram at Arthritis Dietitian. She actually has a program that's going on right now, where she, talks about mostly about how to adjust your diet to help with inflammation, but also goes into a little bit about oral care, and all of that in her program as well. So please feel free to take a look at some of her resources. Thank you, Christina, for giving us some of the information. Although you couldn't join us for the recording today, but we really appreciate any of your insight. I know that she is very big on oral health. So it'll be really good for you to check out any of her resources. And anything else that you wanted to say in closing, Bridget?
I think that's it. Just be very mindful, try to catch it as early as possible. I when this started becoming very problematic for me, it was after surgery and I couldn't get it fixed. And so now everything is just a mess and everything has to be pulled. But you can catch it early. So if you're just mindful and you pay attention to your body and just listen to it. So good luck. Good luck.
Absolutely.
Mhm.
And just remembering oral health is a part of of autoimmune disease management, adaptation, and figuring it out through trial and error is strength, not failure, when it comes to taking care of your body. Small and gentle steps in creating a routine to help with your oral health really matters and can very much help. And again, your mouth is a part of your body and not an optional body part, like we were talking about earlier. It really does feed in to the whole systemic nature of all of our autoimmune diseases. So, oral health is health, it's a general health, and it is important to take care of. One of the other resources that I referenced while putting together this episode was a Go With Us to Conferences video from ACR 2025 about oral health that was actually put together with it from another Canadian a Canadian researcher, doctor in training. So it seems like maybe in Canada they have a little bit more emphasis on oral health. So you can go ahead and check out that Go With Us video. That'll be linked below as well. And to see any more information or resources about coexisting conditions like oral health, disease management, and more, you can check out our aiarthritis.org/patient journey page to see more resources through our blog. We have information about anti-inflammatory diet, information about exercise, and so many other different resources for you to help on your disease journey. And at AI Arthritis, we don't just represent the patient voice, we are the patient voice. And with your support, we can amplify that even further. If you found value in this talk show, please consider making a donation to help us continue producing impactful conversations, bringing all stakeholders to the table to discuss patient identified issues and patient infused solutions. You can visit aiarthritis.org/donate to help us make a difference together. And thank you again for tuning into this episode of AI Arthritis Voices 360. Bridget, if you have anywhere that you'd like the audience to find you, I know that you have any social media or websites that you like to promote.
I do run a patient group here in Colorado called Advocates for Compassionate Therapy now, and we post a lot of information, not just about autoimmune disorders, but a lot of policy, a lot of local issues, and a lot of how to become a good advocate in your state and for issues that are important to you. Just know you're not alone. So check us out. Yeah, we're on Facebook, LinkedIn, Twitter, and I think that's the extent of my social media savvy.
Sounds good. And you can find AI Arthritis on all major social media platforms at IFAI Arthritis. And that's a wrap for this episode. We'll see you here next month on the next episode of AI Arthritis Voices 360. Thank you.